evening and thank you for joining us. I'm Dr. Mahendra Carpen, interventional cardiologist and chief of medical services at the Georgetown Public Hospital. Good evening and welcome to our program, Your Doctor and COVID, on Friday evening. So earlier in the week, we looked at several issues surrounding COVID-19 infection, and the one that I want you to remember always when you go out in public is how to wear your mask. Again, this is the mask. The correct way is not here, not here. The correct way is over the nose and the mouth together, not on the chin, all right? That is the best way to wear it, or the only correct way to wear it, to protect yourself and to protect those around you from potentially becoming infected and suffering dire consequences. I'm in studio today by myself, so I am not wearing my mask for that reason and that reason alone. So I want to talk to you today about a couple of things, but one of the big ones is our use of what is now probably the most advanced medical therapy that is accepted in the COVID-19 pandemic. But before we get to that, let us recap. Earlier in the week, I believe yesterday, we talked about convalescent plasma. And I told you that the science behind it is to take the blood from a patient who has recovered, who has had COVID-19, and that blood will have antibodies or soldiers to fight the infection. We take it from the donor and give it to a patient who is now the recipient, and that recipient is probably not doing well, they're sick, and so they can benefit from the antibodies that are contained in the blood from the donor, because the antibodies are soldiers that help to fight the infection. So the main problems with the infection with COVID-19 is not just the virus itself getting the infection, is what it does to the body. What does it stimulate the body to do? And it can potentially cause what we call an inflammatory storm or a cytokine storm, where it activates the body's immune system, the reaction, in a way that is uncontrollable, and it is dangerous and detrimental to the person, to the patient, where they cannot maintain their blood pressure, they cannot breathe properly, they cannot maintain their proper consciousness and alertness levels, and so therefore that can become from bad to worse, and some of those patients do not survive. So we want to look at what we can do to reduce that overall inflammation. And a very nice big study out of the United Kingdom showed us that something very simple, very easily available has worked. Steroids. We're all familiar with the term steroids. In medical use, we use preferably dexamethasone, but at other times we've had to use hydrocortisone, we have had to use prednisone, but the recommended steroid for use in this condition, what the research was done on, is dexamethasone. What does this do? This is a broad suppressant of your inflammatory response. So people who get, or we suspect that they're having an increase in their inflammatory response, we use the steroid to suppress that, because that inflammatory response in these patients is chaotic and it will cause more harm than good in these patients. This actually starts around the first week or day 7 after infection. The viral load in the body starts to rise from day 1. It will peak just before week 1, and then gradually starts to decrease. Now, as the viral load starts to decrease, the inflammatory response starts to increase, and it can increase rapidly in a way that becomes uncontrollable. And that is the point, before it gets to that uncontrollable state, that you want to use steroids in these patients to reduce the whole inflammatory cascade. And that is the approach that was taken in the UK, and it showed significant benefits in patients' outcome, hospitalization as well as their death rates. And so we're very pleased to benefit from that kind of research that has occurred. And in the modern era, we no longer have to wait for these things to be published in the journals. I myself have been a part of, and currently a part of, several information sharing professional groups, some in simple groups such as WhatsApp, on Facebook, and all social media outlets, that we get information in real time. Now, there's a lot of information out there, so I will spend about an hour every day trying to decipher and decide which are the more relevant pieces of information that would help us in Guyana to manage our patients better. So we have, in a pandemic, in this urgent situation that we find ourselves in, we no longer can wait until information becomes published in a book. We are way ahead of that information game. Now, the big one that I want to talk to you about really is this drug that we call Remdesivir. And we had been trying to get this since April, I believe, through a trial from the WHO. The trial is called the Solidarity Trial, and we had been trying our best to get this medication. But there are lots of criteria to be able to qualify for trials, and lots of, when it's done properly, the trials are very important. But we had taken quite some time to be able to access this medication. So we had to seek alternative methods of getting medication outside of the trial. And we were lucky to source it from a generic manufacturer approved by the original brand to be used in our patients in Guyana. So the drug name is Remdesivir, and it is an injection that can only be given in hospital when these patients are being monitored. And we were able to get it, I believe, late August. And if you were able to follow the news, the first batch that was produced in the US was all bought by the US government for the US citizens. And so there were none, and there probably still is none available from US suppliers and manufacturers for third world countries like us. So we had to seek alternative suppliers. And we were able to get the first batch. I believe we got about 240 doses. And most recently, we were able to source 2,000 doses more. They come in a 100 milligram vial, and we originally started with protocols that can give it to patients for a maximum of 10 days, minimum 5 days. As we learn more and more about medicines and the pandemic, etc., we have gotten enough research to suggest that 5 days is just as good as 10 days, and the longer you go, the more complications you may develop. So we have shifted our protocol now to cater for 5 days in general. So our stock level and everything has been tailored to cater for 1 new patient per day needing Remdesivir, and with at least a 6-month supply on hand. And I'm pleased to say that we are ahead of that game, and so patients have benefited. So far, and this information is about 2 days old, we have used Remdesivir in 15 patients at Georgetown Public Hospital. We were able to see a significant number of patients move from critical to what we call step down, or they're no longer considered as critical. So we would have had about 4 patients completing their course of treatment and being discharged. And of course, they had to be discharged after spending some time in step down and demonstrating that they are well. We have had a total of 5 patients that went from acute or severe illness into the step down unit, and we had to stop 2 patients' treatment because of adverse reaction. Now this drug, it's new, we are learning a lot about it. We know that it has benefits. We know that we've been lucky to have it in Guyana. And the side effects that we look for are mainly things like liver, increase in liver enzymes and increase in kidney functions. The 2 patients that we stopped it in was because of increasing liver functions. Those patients still did okay, but we had to not complete the course of treatment because of the development of this adverse side effect. So we unfortunately lost 3 patients of the 15 who were on this medication. But again, these are very sick patients, and perhaps even without trying the medication, they would not have made it. And it's unfortunate whenever we lose patients. And unfortunately, in this pandemic, we have lost 80 odd patients in Guyana, and we are predicted to lose even more. The numbers will be even higher if we continue to disregard the safety measures and the safety tips that we are all familiar with, that we know. We have to demonstrate a different sense of responsibility. COVID is here, it's going to be here for a while. And if we don't take it seriously, you can die, or your family can die, and those you interact with can die. Simple things that you can do to reduce that risk doesn't cost a lot. It doesn't cost anything at all, really, to wear your mask correctly, to sanitize, and to maintain social distance. As we drive around Georgetown and the rest of the country, you will see that there are persons who are acting in ways that are irresponsible. We may think that the young people are not vulnerable, but as I would have said in an earlier episode, people have underlying sickness or illnesses and they don't know about it because we don't check on a regular basis. And one way in which we will have to address our own personal health and our healthcare system is to ensure that people get proper screening for chronic diseases earlier and in a standardized way. So we have to be cognizant that even young people can become infected and then get really sick because they are not familiar with what their underlying condition can be. Too many people are early stages of diabetes, early hypertensives, and they do not know about it because they do not check. They do not get themselves tested. They do not get physicals or follow up with family doctors, etc. And that needs to change. And unless we do so, and you know with absolute certainty that you do not have any conditions underlying, don't take it for granted. Persons need to assume that because of our genetics, because of our lifestyle, because of our habits, our diet, our lack of, exercise, our social activity like smoking, etc., young people can become just as sick because of their underlying conditions, some known and some unknown. So with that in mind, I want to wish you a wonderful, productive, and safe weekend. And I thank you for watching and thank you for listening across Guyana, wherever you are. Feel free to send us your comments, your questions on the email provided as well as the WhatsApp provided. Thank you and have a good night.